everyone. Thank you so much for joining our webinar on the NPRM and the consumer education and quality provisions within. As always, we are here at the Office of Child Care. We're thrilled to have you on the line, and we did have, again, a number of registrants on this webinar. We think they're slowing down, but we're going to give everybody just about 1 more minute to log in, and then we will get started. Hi again, everybody. Thanks so much for joining us. Again, we are on the NPRM topical webinar on consumer education and quality provisions, and we are happy to have you. As always, you have probably noticed that you are on mute. And as always, it's not because we don't want to hear your questions, it's because we would like to avoid any background noise. So as you have questions or comments throughout, please feel free to chat them in through our chat box. We'll answer as many questions as possible towards the end. I will note, though, once again, that any comment submitted through this chat box does not actually count as an official NPRM comment. We'll talk more at the end of the webinar about how to officially comment. Finally, as of now, the webinar and the slides are not available online, but we are hoping to make them available within about a week. And we will send out, as soon as they're available, we'll send out an email to everyone who registered for this webinar, letting you know where to find them. So with that, I will pass it on over to the Director of the Office of Child Care, Rachel Schumacher.
Thank you, Tricia, and good afternoon, everybody around the country. Welcome to the third and final of our 3 topical webinars. This one, as you know, focusing on consumer education, family engagement, quality provisions in the law. In the NPRM and the law. We will be covering both. I am very excited to be able to focus on this topic. It's the last but not the least of what we think the law and the NPRM are accomplishing and envisioning for the future of child care for this country. As many of you probably are aware, being on this call, people from all over the country who've been working on these issues for many years, the type of research that has been done in the last decade, and certainly since the last reauthorization of the Child Care and Development Block Grant, has just been phenomenal, really helping us understand so much more than we ever did before about early childhood brain development, the importance of relationships with caregivers, and parents, and how all of those things together really build a brain architecture that sets children up for a lifetime of learning and relationships with other people. And so I think Congress was also looking at this type of information, and as well as looking at sort of what we know about the way Child Care and Development Block Grant funds are spent and who they go to, and that these are very vulnerable children and families around the country, and wanting to see that this block grant was able to really help assist young children to reach their optimal development, and to make sure that we're really forging the way toward a new future for child care for children in this country. And working in partnership with their parents. So This webinar is going to focus in on all those provisions, and I am very excited today to be having the room and to help with presenting my colleagues Megan Campbell in the Policy Division and Mary Sprague, also in the Policy Division here at the Office of Child Care. I should also give a shout out to Adele Robinson, who is with the Office of Child Care now too, and many of you have known for many years, who has been very helpful with us working on a lot of the professional development areas in here, and may jump in later when we have questions if we get any. We are going to move on now to just do a little bit of background framing for any of you who are not, who have not been participating in the number of webinars we've been having. And surely if you're on this call, you're very aware we have a new law and that it was a very big change and re-envisioning of childcare for this country, and that we in this webinar will be focusing on some key aspects, but by no means should you see this as a substitute for reading the full text, which is available in the Federal Register at this link you see here. For the rest of this session, we'll be using the term NPRM. That is a Notice of Proposed Rulemaking. This means that we have taken a look at the statute and a lot of other research and information and the history of people's comments that happened in the previous NPRM that we had, the Office of Child Care had initiated before Congress took action, and developed proposed regulations which you now have an opportunity to comment on until February 22nd. And we will then be reviewing those comments and issuing final regulations with a hope that they would come out by the summer of this year. That's a very quick timeline, which we'll go back to when we talk about your process for submitting comments. So the proposed changes that we have grouped into different categories just for ease of understanding and explaining what the NPRM is trying to do. These are the 4 areas. This webinar will focus on the 2nd and the 4th here, as I've already said. So in the webinar, we will be going over these sections. So first, we'll focus in on the consumer choices piece and access to information to support child development. Then we'll go on to the quality provisions, and we will talk about how these provisions all apply to tribes, and then we'll revisit the public comment process and how you can have your voice heard in terms of your reactions to some of the things we're explaining here. We really do see we really want to emphasize that one of the new purposes of the Child Care and Development Fund that Congress added is to increase access for low-income children to high-quality care and to promote child development. And so this session is going to unpack some of the provisions that were in the law and how the NPRM clarifies those as we move forward. So I'm going to turn it over now to Megan Campbell, who will walk you through the consumer choices information. Megan?
Thanks, Rachel. Hi, everybody. Thank you for joining us on our 3rd webinar. As Rachel said, I'm Megan Campbell, and I'm in the Policy Division of the Office of Child Care. We'll be going over in this section the provisions in the NPRM that are about helping parents make informed consumer choices and access information to support child development. As you'll see, the slides have a lot of information on them. I'm not going to read through all of them, but the slides, as Tricia said, will be posted online and sent out to those of you participating today. Also, as a reminder, which I'm sure you know, the slides break down the NPRM, but clearly do not cover the entire long, wonderful document that it is. So it does not replace reading the whole thing, and we hope you will look at the entire NPRM on regulations.gov. Okay, so moving on. Consumer education is a really important part of our program because it brings together a lot of critical components that are built into CCDF, especially things like parental choice, but if parents don't have information, it's hard for them to make informed choices. So we're really excited that Congress put a huge emphasis on consumer education in the reauthorized law. And here we just lay out a few of the key provisions of the law before we jump into what the NPRM says. First, they provide a specific list of information that states should provide to parents of children receiving CCDF, the general public, and something new they added was for child care providers where applicable, really acknowledging that child care providers are a key resource for parents and it's important for them to understand this information as well. It also includes requirements for the state's consumer education websites and a new national website that will be located at childcare.gov. And also I want to point out that the statute does include that this information can be provided through resource and referral agencies or other means. So this is by no means saying that the state has to do all of this by itself or the lead agency. They can continue to work with child care resource and referral agencies and other groups to make sure that this information gets out to the public. Okay, so this is a lot of information. There's a section in the law that deals with some general consumer education that states are required to provide. And as you can see, it's a wide range, including the availability of child care services provided through CCDF, other assistance programs for which the family might be eligible, such as TANF or WIC, and also state policies regarding the social emotional behavior of young children, including policies on expulsion and early childhood programs. We took the opportunity with this information through the NPRM to clarify that those state policies regarding the social emotional behavior should really include birth to school age or be age appropriate, and also that the policies on expulsion and suspension should apply to children birth to age 5, not just limited preschool age. And also, states will need to describe their suspension and expulsion policies for children birth to age 5 in their state plans. Okay. The second key component of the consumer education was providing information to parents and providers about developmental screening. And the law requires that lead agency provide information on existing resources and services related to conducting developmental screenings and providing referrals. The NPRM would then require that the resources about developmental screenings be provided to parents during the CCDF intake process. We think it's important that parents receive that information when they are coming in and have it clearly explained to them, and also to providers through training and education. Because again, as we mentioned, providers are a key resource for parents, and also identifying children who might need to have a screening early. We do not require that children receive a developmental screening. This is about providing resources about the screenings or referrals to them, but we do recommend that children receive a developmental screening within 45 days of enrollment, which is in line with the requirements of Head Start. Okay. And then lastly, in this piece of the consumer ed, we really think that it's important that parents who receive CCDF assistance are given the full details of the child care available to them, as well as detailed information about potential child care providers or the provider that they have chosen to care for their child. Therefore, the NPRM is proposing to require that CCDF parents be given a consumer statement when they come in for intake. And it includes two components: the general information, which would include information about how CCDF subsidies are designed to promote equal access, or how a parent might be able to submit a complaint through the parental complaint hotline, which was discussed during our health and safety webinar the other day. It also has provider-specific information, such as the health and safety requirements met by the specific provider, or the date of the last inspection for that provider. And one thing I want to point out is in the preamble, we do have a kind of lengthy discussion about all the different ways that states do their intake and how there's different methods online, through the phone, in person. And we really try to cover different options for that, because we recognize that there's a lot of variation across the country. And so we want to make sure that this works across lead agencies. Okay, now the consumer education website. The law requires that the states make information available through a website about processes for licensing, monitoring, and inspections, and background checks
These are more focused on state policies, just an explanation of that. And then it also requires providing specific information on the quality of providers if it's available for the provider. And then lastly, it requires annual reporting of the number of deaths, serious injuries, and instances of substantiated child abuse that occurred in child care settings each year. And so for the NPRM, we clarify that all these components should be brought together into a single consumer-friendly and easily accessible website that ensures the widest possible access to services for families who speak languages other than English and persons with disabilities. The state's lead agencies have the freedom to define consumer-friendly, but we do suggest looking to things like Section 508 of the Americans with Disabilities Act to help with make sure that it's accessible information, as well as translating into languages that are common in the communities you serve. Okay. Now, the consumer education website has several components. As you can see, there's a lot of information in this slide, but we hope that it provides a visual way of breaking down those components for you. So the first one is state and policies and procedures. And that just includes information about how states license providers, how they conduct monitoring and inspection reports, the policies related to background checks for providers, including how a provider can request a background check, and any offenses that would prevent an individual from becoming a provider based on those background checks. That's the first piece. And then we move into the provider-specific information. And then this information, I want to clarify, is for all CCDF providers and also licensed non-CCDF providers. Because parents have choice in how they use their subsidies and their vouchers can go to almost any provider, it's important that they have access to providers who may not have already served a CCDF child. And so therefore, we think it's important that that information be posted online for them to see. And you can see it's a localized list of providers, searchable by zip code. Again, the quality of the provider, if available for that provider, the results of monitoring inspection reports, and I'll provide more detail about that on the next slide. And then the number of serious injuries and deaths of children that occurred at that provider. So that will all need to be provider specific. And the next piece, which is what was in the law, is aggregate annual data on the number of deaths and serious injuries and instances of substantiated child abuse that occurred in child care settings. And when we were talking to states and stakeholders throughout this process since reauthorization passed, we got a lot of questions about defining some of these terms. We've chosen not to define serious injuries in the NPRM or substantiated child abuse in the NPRM. That is left to the definitions in the states. Then fourth is referrals to local child care resource or referral agencies. And then finally, contact information, and it should include information on how parents can contact the lead agency or another designee, such as an R&R agency, for help understanding the website. The internet is very helpful, and websites can be really useful, but they can also sometimes be a lot of information to take in. So it's really important that parents have a way to reach out to a person to help walk them through some of this information. Now, monitoring and inspection reports. And if you were hopefully on the health and safety webinar last Friday, you've seen this slide before. But so the Act requires states make the results of monitoring and inspection reports available by electronic means. So the NPRM clarifies that the electronic means should be through the consumer education website, which we just discussed. And states must post the full monitoring and inspection reports in plain language. It's really important that parents and providers be able to understand what these reports are saying. It's not very useful if there's a lot of jargon and code that no one can read. So we think it's important that the reports be in plain language. However, if the report itself is not in plain language, states are allowed to post a plain language summary in addition to the full report. Next, we expect the reports must be posted in a timely manner. We're not defining timely, but we do recommend that they be posted within 90 days of inspection in the NPRM. And finally, going forward, so that's from the effective date of this provision, which is November 19th, 2017. It's one of the provisions that had a delayed effective date in the law. So going forward from that, each provider should have at least 5 years of results posted as long as they are available. Having a single year of results can really mask a provider's health and safety history, and we think it's important that parents have access to basically whatever information the state has. All right. So, as I mentioned before, the law requires HHS to create a national hotline and website for consumer education and for collecting reports of suspected health and safety violations by a provider. And the law specifies that the website will be childcare.gov. Now, most of the requirements of the national website overlap with the requirements of the state websites, but there were a few that were just applicable to the national website. So the NPRM extends those requirements to the state website because it's not really efficient, and it doesn't really make a lot of sense for the national website to be trying to duplicate data that the states already have. And so the components that are extended from the national website to the state website are a zip code-based localized list of all eligible child care providers, referrals to local resource and referral organizations, and ensuring the widest possible access to services for families who speak languages other than English. All right, and then finally, of course, we want comments on all of throughout the NPRM, both on things you like and things you maybe don't like as much. But here are a few areas related to consumer education where we are particularly interested in getting your feedback and information on your experiences, best practices, etc. And I just want to highlight that one of those areas is on the database and website requirements for lead agencies to facilitate the linkages to the national website, which I just mentioned, and also best practices for ensuring accurate data related to child injuries, deaths, and child abuse incidents to make sure that they're collected and posted in a useful way on the consumer education website. And a full list of all the areas for which we are requesting comment throughout the NPRM is on the OCC website. So with that, I will turn it back over to Rachel.
Thank you so much, Megan. And I am going to go through, this section includes a set of provisions around enhancing quality and also the provisions that are in the law and NPRM around what we can do to really shore up our early childhood workforce. So one of the first things to note is that in terms of focusing on quality improvement is that the statute is really moving more funding from the grants, more of a percentage of it to increase over time to focus in on quality. So many of you know that for many years there's been a 4% quality set aside in the Child Care and Development Block Grant that each grantee, each state territory is using for quality. And now with the new law, Congress has changed this so that it's going to grow to 9% by 2020. But there's also a new 3% infant toddler set aside that starts in fiscal year 2017. And with the two of those things together, by 2020, we'll be at 12% total. And this is going to apply to CCDF money, discretionary, mandatory, and federal and state matching. So we are looking at an opportunity for states and lead agencies to really think about how do I use this money and what are some of the opportunities. The law was very specific around this too, and because the law had a lot of specific language for each of these 10 listed areas, you will see much of that same language is basically the same in the NPRM. So lead agencies must spend their quality funds on at least one of these 10 areas you see listed here. And they're familiar areas that have been longstanding areas of focus for states in their quality expenditures. The 10th is other, but it says other measurable quality activities as determined by the state. So what I think when I started off the webinar, I talked about how Congress was interested in seeing quality expenditures increase, but really what is the success of our quality expenditures? What's really going on there? And so there are new requirements in the law, and then we clarify in the NPRM around measurement and reporting on quality investments. We really heard from Congress an interest in knowing how is this money being spent, how much is it, and on what. So in this chart you can see an explanation of some of the ways in which we will be able to report annually, and using the information that will be reported by all of our lead agencies around the country will need to report to the Office of Child Care on their quality expenditures and their quality activities and measures used to evaluate those activities. So there will be a set of expenditure reports around total expenditures, both on the quality part, the infant and toddler part, and assurances that state met quality and infant toddler minimum spending requirements. And in addition to that, we have a quality progress report that is in the process of being updated now, but states have been familiar with reporting on over the last set of years. These will include what the descriptions of activities are, the measures that this lead agency has chosen to evaluate progress in improving quality, and any data on the extent to which the state has been able to meet those measures. So we really will have a new set of information and data to look at over the next set of years, and this is what the NPRM clarifies. Another focus of the law and of the NPRM is that, access to high quality care depends in part on the fact that you have to have a supply of care from which parents can choose in order to really realize that goal. The law requires states to take several steps to increase the supply of high quality child care, and you can see them here in this chart. They're including describing strategies to increase the supply and improve the quality of child care for specific populations. So we see here children in underserved areas, infants and toddlers, children with disabilities, and children who receive care during non-traditional hours. We also have in the law sections that talk about prioritizing increasing access to high-quality child care services for families in areas with significant concentrations of poverty and unemployment, and encouraging public-private partnerships to increase supply and quality. So the NPRM builds on these provisions, which were all in the law, as you see in the chart, by also making a connection to other provisions around business practices. So that's the other piece of building access to high-quality care, is that the business of child care is a hard business, and to be able to provide a really high-quality program and pay the bills, states will be involved in providing some strategies to strengthen child care providers' business practices, and that this is another feature making the connection to the need to build a supply of high-quality care. Another method that is discussed in the NPRM are the options states have to use grants or contracts in their direct services. That means their subsidy provision for low-income children and families. So the NPRM is going to require, and we're asking for comment, the use of grants of contracts to fund direct services that could be used to address shortages in the supply of high-quality care. And we have seen states use this strategy over the years, particularly around some of the same populations named in the previous slide. In their CCDF plans, states will be asked to identify the shortages they're seeing, list the data sources they use to find those shortages, and explain how grants or contracts will be used to address them. And the NPRM also clarifies that faith-based or religious organizations may be funded through grants or contracts, although that funding may not be used for religious purposes. And also, this slide shares that the NPRM, this does not mean that the NPRM is saying all services need to be delivered through grants or contracts. It's merely saying that the grants or contracts should be used and must be used as a strategy to help build supply as the state identifies those needs. The next set of slides are around the workforce and our need to really enhance the quality of our workforce and both in terms of recruitment of folks and providing pathways for folks to attain higher education and retaining our workforce. And everyone on this call is, I'm sure, much familiar with this issue. It's been a long-standing issue in our field, as well as hopefully all of you are aware of the National Academy of Science report that came out last year around the importance of raising the qualifications of our early childhood workforce. So this slide discusses the infrastructure components that can be put into place to really help with the training and professional development of our workforce. On the left side, you see a set of things that were required by the law. The law talks about the importance that all states create and have to create a progression of professional development, which may include the pursuit of post-secondary education, and that plan that the states need to put together around their professional development should be developed in conjunction with the State Advisory Council, which many states have, or some other similar body in a state. That states may engage the training providers in aligning with the state training framework, and that there are assurances that training and professional development will improve the quality and stability of the workforce. Now, the NPRM takes this and takes this language around states engaging in developing a framework and really tries to unpack what a framework should look like. And the components on the right-hand side, you see the state framework developed with the SAC should include, to the extent practicable, these key pieces which are recognized in our field as critical for really developing a framework for professional development in a state, and the pieces of a system that help that happen. So those include professional standards, career pathways, an advisory structure, articulation, workforce information, and financing. The NPRM also talks about how ongoing accessible professional development needs to be aligned to this progression of professional development, and that training and professional development requirements must also improve the diversity and retention of the workforce, which is such a key issue that we are facing now. So moving on to the next slide, let's get into some of the other specifics that make up what we think is really a great opportunity for states and lead agencies to really revisit what we're doing, what's in the law around training and education for our child care workforce, and where we need to go as a country. So one thing that you're all very familiar with and probably remember from our health and safety webinar is there's new requirements for training for CCDF caregivers, teachers, and directors. So the NPRM clarifies that the pre-service orientation and ongoing training requirements for CCDF providers includes caregivers, teachers, and directors. We got a lot of questions about what does providers mean. And adds some definitions around teacher and director so that those are really much more clear. We also, in the NPRM, propose requiring that this training be aligned with the state framework to the extent practical. In terms of pre-service and orientation, the NPRM clarifies that the orientation and pre-service training must include major domains of child development, and that ought to be completed within the first 3 months of service. We had a lot of questions about what does orientation mean, what does pre-service mean, and we thought this was a reasonable interpretation of that standard. Another thing that we have in the NPRM is an encouragement for lead agencies to consider credentials that can be used as a proxy for meeting any or all of the pre-service or orientation areas to avoid unnecessary repetition. We know that states have been very busy over the last set of years developing their own credentials in some cases or different types of training, and we want to make sure that states have an opportunity to take into account what they already have and that they're not requiring folks needlessly to say, hey, take these set of trainings in order to comply, without having the opportunity to look at what other things folks may already have been able to complete if it meets the standards. Okay, so another provision that is important to think about in the professional development framework is the annual ongoing professional development provision. So the NPRM adds that this ongoing professional development requirements must address maintaining and updating health and safety knowledge that is listed in the pre-service orientation. And this is really critical because it's really important that these basic training requirements that are now required of all CCDF providers not be sort of one-shot things, basic training that folks are taking over and over again. What's really important is that it be maintained and updated and folks be able to build on their health and safety knowledge, and that it follow any new developments and what we know about health and safety over the years. It also links the NPRM language to the extent practicable to we ask for ongoing professional development training that should link to CEUs or college credit. And this is, again, getting at the idea that we don't want folks to feel, okay, there's a bunch of training, check, that training is done. It's really an incredible opportunity to think about meeting folks where they are and when they come into the profession, and what do they need to be able to move forward over time, and hopefully ending in the goal that's articulated in the NAS, that the National Academy study that I mentioned before, articulating ultimately our goal is for folks in this profession to have at least a bachelor's degree, and that's something that we're all working toward over time. Next, I just want to revisit okay, so I know when folks read the law, people thought, what is a progression of professional development anyway? And so here's the different ways in the NPRM, to recap, that we tried to help articulate what we think that means. The career pathways and articulation are two of the components of a state framework that I mentioned before. That the state's ongoing professional development requirements are not singular sort of one-shot basic things over and over, but that states will be maintaining and updating health and safety knowledge over time, and that individuals will be updating their knowledge over time and building on it. And as I just said, to the extent practicable, that the ongoing professional development training should link to CEUs or college credit. So we're hoping, and we're very interested in comments around whether this is a workable framework and whether it helps really move our field forward for our CCDF providers and for all the children and families who rely on them every day. So I am now going to hand it over to Mary, actually for the first time, Mary Sprague, who will help us understand how these provisions apply to tribes.
Great. Thanks, Rachel. Hi, everyone. I'm Mary Sprague, and like Rachel said, I'm going to talk about how these provisions apply to tribes. But as you all know, if you've listened to our past two webinars, before I really start digging into how the consumer education and quality provisions apply to tribes, I'm just going to start by giving some context. And so this is sort of setting the stage for some of the proposals that we're including in the NPRM for tribes. So as you all know, many of the provisions in reauthorization did not explicitly apply to tribes. And so before we even started writing the NPRM, we held a series of consultation sessions in the spring of 2015 to talk to tribes about the potential impact of these provisions on tribal communities. And we actually held a session specifically on quality improvement because we wanted to have more of an in-depth discussion with tribes. So we took all of the input and the feedback and the conversations that we had with tribes and came up with a new framework for tribal requirements that's kind of different than what the current regulations are. So currently, there's exempt and non-exempt tribes. Non-exempt tribes are tribes that receive over $500,000, and they're subject to the majority of the CCF requirements. Exempt tribes are tribes that receive under $500,000, and they are exempt from operating a certificate program, and they're also exempt from meeting the quality spending requirements. So when we looked at the requirements and reauthorization, we didn't really think that this framework really worked for tribes, especially given the wide range that we have in allocations, as you can see from this slide. So we're proposing 3 different tiers with 3 different with scaled requirements. So tribes with large allocations would be subject to the majority of the CCF requirements, whereas tribes with small allocations would only be subject to a very limited number of requirements. So now, all that said, we can start to dig into the consumer education and the quality provisions. So I'll start with consumer ed. Tribes receiving large and medium allocations would be subject to the majority of the consumer education requirements. As you can see from this, the table at the bottom of this slide, tribes are exempt from having to create a consumer education website, but large and medium allocation tribes would still need to collect and disseminate that provider-specific consumer education information that we discussed earlier, because we think it's really important that parents are able to make informed choices about their child care. Tribes receiving small allocations would be exempt from this requirement. So for quality, though, all tribes would be required to spend a percentage of their total CCF funds on quality improvement activities, and that includes the 3% infant toddler set aside. So like the health and safety requirements, we think that quality improvement activities are a really important part of a CCF program, and so that's why we think that all tribes should be required to spend a percentage of their funds on quality activities. There's also a lot of flexibility that Rachel discussed earlier in how tribes can spend their funds on quality. So we believe that many of the tribes with smaller allocations are actually already spending money on quality activities, even though it's currently not a requirement. So just to finish up, this table at the bottom shows a list of tribal-specific exemptions, including the quality progress report that we talked about earlier. We might make some additional changes to the tribal expenditure and administrative data reports, the 696T and the 700, but we'll discuss those changes with tribes first and, of course, provide opportunity for comments. So with that, I'm going to turn it back over to Rachel to talk about submitting public comments on the NPRM.
Okay, thanks, Mary and Megan. So we are going to now just go over these pieces of information around exactly how to submit your comments. If you've been in the other webinars, you've seen these all before, but this slide goes over the very specific method of submitting your comments, and we do encourage you to submit them electronically. That will be much easier for us to get through them all, but you may submit them by mail if you wish. Our next slide talks about how specific we urge you to be in your comments. As we described before, we are trying to break records in terms of regulation by getting these done in a quick period of time, and so it's very helpful to us if your comments very specifically tell us which part of the NPRM and the Federal Register page that you are commenting on, so that we can organize all the comments we receive and analyze them. So you see here page number, column, et cetera, et cetera. That information will be really useful. We also, on the next slide, want to remind you that all comments received are part of the public record and will be posted for public viewing. And that means you should be careful about what you put in them. Personal information will be accessible. So if you want to remain anonymous, you will have to indicate that by entering an NA in the required fields. We'd also like to encourage folks on the call to really, if you know lots of other peers who have similar bent as you are, to organize yourselves and put in your comments jointly. That will make it a lot easier. With a lot of folks signing on to one set of comments, we can just analyze those comments and understand that they are the feelings of many people. And will be a lot easier for us to manage the influx of comments that way and analyze them all if you could do that. And then I think we are at the point where we can take a couple questions. And this is information, this is a place you could go for more information about reauthorization and other types of resources that we've made available. We have just a few minutes, so let's talk about some of these things that we've received. So one question we received is, are there legal issues to vet regarding the public posting of information for license-exempt providers? This is something that we've been told is not public information because they don't receive a child care license. So our answer at this point is that license-exempt providers that care for children receiving CCDF, they are receiving public funds, so it is important that their health and safety information be available to the public as a matter of informing parent choice. We do understand that there are some concerns about privacy for license-exempt providers, and there are options discussed in the NPRM about ways for states to post this information without posting private information. It's on page 80494 of the NPRM. Another question we received is around teacher-provider wages. Are they an allowable expenditure for quality activities? If you look at our quality activities language in the NPRM, quality funds may be used to help caregivers access resources and education that may provide scholarship and compensation improvement. States may also use their other category for quality funds to increase payments to cover the cost of high-quality care. Also, there are ways in which states, if they're thinking about their provider rates, when you raise provider rates, that can translate into higher wages for those who are receiving those rates. One of the provisions that we talked about when we were talking about equal access in our webinar last week on subsidy and equal access issues was that states lead agencies need to take the cost of quality into account when they're setting their provider rates. And that's another way of thinking about this very important issue. Thank you for that question. Someone also asked us if there is a definition for underserved and whether this is limited to building supply. Underserved is not defined in the NPRM. It was actually included in the law and the statute related to supply building, but we welcome comments on this area as appropriate and your thoughts on what more we could do to clarify it. Do you have any other questions at this point, or should I wrap it up? You would say. Okay, so people are asking about definitions. We have definitions that are listed actually in the NPRM for some of these categories of caregiver, teacher, director, what we mean by those things. So those are in the NPRM if you're looking for that information. I don't have the exact page number, but perhaps the staff can figure that out while I'm saying some other things. And let's see, there's a question on the tribal portion. Is that something you want to take?
Yeah,
Mary?
sure. So this question is about whether the certificate program is the same as grants or contracts. So when I said that exempt tribes don't need to operate a certificate program, I meant that they don't need to operate a child care program that has all 4 categories of care. So it's different than grants or contracts. And from the tribal slide, you'll see that we've exempted tribes from the requirement to use some grants or contracts for care.
So the page, thank you, Mary. On the page, let's see, where is the page number here? 80563 of the Federal Register is the page that has the definitions section, which you can take a look at, where we do have definitions for teacher and director and provider, eligible child care provider, if those are useful to you, family child care provider. So please take a look and feel free to comment if you have suggestions or feel that there are additional definitions needed.
I'll mention again for anybody who missed part of the webinar, whether you came on late or had to pop out for a fire drill. We had that happen at one point recently. The slides will be available and the full webinar will be available. Our hope is to have them available by about this time next week. You may have heard that DC is facing something sort of epic weather event. So even if we can't get the full webinar online, you know, within a week, we'll make sure that we can get the slides posted so that you'll have access to that information. But like I said, I would think by about this time next week, or certainly by the end of next week, we'll be able to have the full webinar available to you.
There's also a question about the semantics, basically the words of voucher program, certificate program, someone saying we use these interchangeably. Is there a definition the same? I mean, I think we use those terms fairly interchangeably as well, and we know states might have their own terms and they have their own names for the subsidy programs. So I don't think we have any type of feeling that one is better than the other or anything like that. It's just language is the way it was written in the law, and I think then states have adapted the language as it works for them. So both basically mean the same thing. So I think we're basically going to wrap up here, but before I do, I did want to take a moment, and again, we'll thank Adele for helping me think about this at the end of this session, to say we have lost a really important leader and advocate in the child care world, Patty Siegel, who passed away on Christmas just recently. And she really was, it's important that we mention her, especially during this session, which talks about consumer education, since she led and was the founder of the first resource and referral system in California, and created Parent Voices, giving low-income parents training and advocacy opportunities and empowerment opportunities as a platform to voice their needs for child care. She was also very active at the national level in terms of letting her voice be heard with her congressional leadership and with everyone here at the national level. She really was a force of nature, and she will be sorely missed for her passion and her creativity and everything she did in her lifetime for quality, affordable child care. And we all owe her a debt, I think, in this field, and we'll miss her very much. So thank you, everybody who is on the call, for everything you've done in your lifetime and will continue to do to support quality child care and increase access to quality child care for low-income children and families. Your work is so appreciated, and we couldn't do what we've done without your support out there, everyone listening, and look forward to continuing to work with you in partnership over the next year as we take in your comments and try the best we can to get this regulation done by the summer of this year, and help all of our lead agencies and work in partnership with them to be successful as possible in their implementation. We appreciate your time and attention, and this is the last of our webinars. Thank you very much, and have a great day, and I hope you are not affected negatively by the weather situation that we are facing here, and are safe and sound. So have a great day. Goodbye, everybody.